Hi everyone, this is Dr. Chandershekar, practicing consultant physician based at Mogatpur West, Chennai. We all want to keep a good health. Of course, we would like to have a strong heart, strong brain, and strong kidney. There has been very much less awareness among the public, sometimes even among the doctors also, on the liver health. Liver is a very vital organ that is used to detoxify our body. It's one of the organ most affected with any kind of infection. Whatever the infection, the liver is the first organ to respond because it is vital in producing various life-saving chemicals and nutritious substances like protein, carbohydrate, fat, and whatever the cytokine or inflammatory markers, most of them are produced in the liver. Unfortunately, the liver health is the one which is most neglected one. It has been afflicted with so many sober habits, including alcoholism. People who are having chronic alcoholism, they are at risk of developing liver disease. Again, another major chunk of liver problems are the fatty liver, which is usually common in obese individual and in diabetes. But what is more preventable is the liver problem due to infections, in particular that are due to hepatotrophic infections. We call it as a viral infections resulting in liver hepatitis. We are going to celebrate World Hepatitis Day on July 28th to create awareness on the liver health due to hepatitis virus. We are having a small talk now. We know that the hepatitis virus which afflicts liver can be of several types. Usually in a community setup, we do see the hepatitis infection, particularly the hepatitis A virus and E virus. These viruses are fecal-oral in transmission. They are caused by taking a food or fluid that is contaminated with hepatitis A or E virus infection. Usually it results in a short incubation period and the patient gets some kind of symptoms, like they may have fever, nausea, vomiting, abdominal discomfort, particularly on the right hypochondrial region, and after a couple of days they develop the yellowish discoloration of the skin and eyes, that we call it as jaundice. This is usually self-limiting diseases, but in certain populations, say for example the extremes of age, children and elderly population, and in pregnancy, that can be fatal also. The best part of these viral infection is these infections are preventable. So we do have hepatitis A virus vaccine that can be given to all individuals. Of course, we do promote HAV infection as an adult vaccination also. In addition to that, we do have the other viral infections like hepatitis B virus. My focus would be more on the hepatitis B virus because it's more deadlier than hepatitis A and E virus. But the best part of it is 100% preventable by taking appropriate vaccine since birth. This hepatitis B virus is caused by a hepatotrophic virus, HBV virus. We call it as HBV virus, that usually spreads through several modes. From an infected mother, they can pass the infection to the newborn baby. Similarly, a person who is affected with this hepatitis B virus can transmit the virus through sexual contact to their partners. And it can also be sometimes caused by sharing some unsafe razors, needles, and sometimes splash of blood also. Nowadays, tattooing and piercing is the very common fashionable things among the younger generation. So we do see if they use unsterilized instruments or needles, again they are at risk of developing a hepatitis B infection. Hepatitis B infection can be of acute infection as well as the chronic infection. The acute infection, usually they may have some kind of malaise, mild fever, fatigability, nausea, vomiting, all these kind of things. And of course, jaundice also can happen. But once the virus sets inside the liver cells, the hepatocytes, it becomes a chronic stage. Once it becomes a chronic stage, then it can lead on to several life-threatening complications. The liver, which is firm in consistency, usually when they are afflicted with hepatitis B infection, the tissues of the liver will get altered. The architecture of the hepatocytes gets altered and they become fibrosed. So once they become fibrosed, the liver loses its functional capacity. As I already alluded to, the liver does various functionality, not only in our immunity, but also to strengthen our nutritious components also. Once they become a chronic hepatitis B infection carrier, the liver gets fibrosed and over a period of time, it can become shrunken, a condition we call it as cirrhosis. Once it becomes a shrunken liver, most of the liver function would get deteriorated and the patient may get several other complications because of the cirrhosis. To avoid this condition called cirrhosis and its due complications later on, the vaccination is the best thing. Nowadays, since 2012, we have been practicing in India the concept called adult vaccinations. The person get vaccination for hepatitis B infection. It takes usually 3 doses. But one thing which we remember is, in a country like ours, where alcoholism is a social menace, most of the people, they drink and they get some amount of liver injury. When it is added along with the